Good evening. The pandemic has brought a number of challenges to our world, but one many people didn't expect was a spike in liver disease. Thanks for joining us. I'm Denise Valdez.
And I'm Brian Loftus. It's due in part to an alarming rise in alcohol consumption. 8 News Now reporter Madison Kimbrough spoke to a doctor who says in his decades of practice, he's never seen it this bad. She's live with more. Madison?
Yes, this is a sad, sad reality for hospitals all over the country as more and more people are being diagnosed with liver-related illnesses. And the age range of those recently diagnosed is startling.
Everything's been affected by this pandemic. And that has led a lot of people who were actually doing fine and stable and had kicked their habit, gone back to drinking.
It's a phenomenon seen all over the country as hospitals report a dramatic spike in alcohol-related entries for critical illnesses like liver disease. The reason? Experts say people are turning to alcohol to cope with the pain of loss and depression.
And I've seen people continue to use drugs even more than they did before. And now the focus is on loss of jobs, of people dying, of social interaction. And unfortunately, people feel so isolated, so what they do to cope is they drink and use drugs.
There's been a 30% uptick in alcohol liver disease admissions in hospitals, according to Dr. Sood, a gastroenterologist in Henderson who has over 32 years of experience in the medical field.
I had lots of patients with alcoholic liver disease, but they were stable. They were doing fine. They were not deteriorating by any means. They were not heading towards transplant, need for transplant or cancer. But this pandemic has really thrown a wrench in things.
And the age range for patients is changing too, at an alarming rate.
The age range is usually in the adults, but interestingly, in the last few months, we've seen more of younger people than people, I would say people in their anywhere younger than 50. I've had an alcoholic hepatitis cirrhotic patient who we had to do a liver transplant at age 17.
Yes, and according to an LA Times article, the disease also makes people more susceptible to COVID-19. Patients with liver disease die of COVID-19 at rates 3 times higher than those without it. Reporting live, Madison Kimbrough, 8 News Now.